presenting. We're going to talk about three things today. And the first thing we're going to talk about is HIV. Everybody see this?
Yes. Okay.
HIV. I'm sure you know about it, but I want to reiterate about it because, you know, it's a problem with your immune system. What is HIV? HIV is the human immunodeficiency virus. It's a unique virus. It is a retrovirus. It invades CD4 cells, otherwise known as helper T cells, in the body of the host. It is a global epidemic. It is preventable, manageable, but not curable. It used to be called a lot of things. You don't have to know what it used to be called, but these are the things that it used to be called. What is AIDS? AIDS is an acquired immunodeficiency syndrome. It is caused by the HIV virus. This disease limits the body's ability to fight infections due to markedly reduced helper T cells. CD4 cells are the ones that are infected with this virus. Patients have a very weak immune system and are predisposed to infections that normal people don't get. And those infections are known as opportunistic infections. When your immune system is suffering, there are bacteria, fungi, and viruses that attack your immune system that would never be able to attack your immune system with a normal immune system. Opportunistic infections and malignancies that rarely occur in the absence of severe immunodeficiency. Things like PCP, pneumocystis pneumonia. It's unheard of in normal people with normal immune systems. You can get central nervous system lymphoma, which is unheard of in people with normal immune systems. Persons with positive HIV serology who have ever had a CD4 lymphocyte count below 200 or a CD4 lymphocyte count below 14% are considered to have AIDS. So when your CD4, remember CD4 are helper cells, when your CD4 lymphocyte count drops below 200, you now have AIDS. It is a retrovirus. Retroviruses transcribe RNA to DNA. That's how they work. That's how they work. All right? And you can kind of see the anatomy of the AIDS virus right here. Its core center is RNA. So how is HIV and AIDS transmitted? Well, I can tell you how it's not transmitted. It's not transmitted from saliva. It's not transmitted from tears. It's not transmitted from mucus. It's not transmitted from urine, sweat, or feces. But it is transmitted by blood. It is transmitted by sexual fluids, semen and vaginal fluid. And it is transmitted by breast milk. And here, the fluids that are transmitted are from high to low. So blood is the number one problem. semen and vaginal fluid 2 and 3, and breast milk number 4. All right. Sharing needles. Obviously, if you share needles with somebody, you share their blood. You share their blood. So it's very important to understand that you shouldn't be sharing needles. You shouldn't be sharing needles, period, anyway. Okay? Or unsterilized blades. Unsterilized blades. Okay? I used to work in a hospital in the emergency department, and if we had an HIV patient come into the emergency department, we were all worried about sticking ourselves or cutting ourselves with the blades or the needles that we used on these patients, because blood is the number one transmitter of the virus. Okay? We would have nurses come down from the hospital floors and say, I'm treating a patient that has HIV or AIDS, and his urine splashed in my mouth. I'm worried that I'm going to get AIDS or HIV virus from that. And we would tell them, there's really nothing to worry about. Urine does not transmit the HIV virus. Okay? You can also get it, obviously, through sex, and usually it's unprotected intercourse, whether it be oral or anal. You can also transmit it to your baby if you are pregnant. Okay? Before birth, while you're pregnant, and during birth. Mothers that are HIV positive should not breastfeed their babies, because you can transmit the virus through breast milk. All right? So what are the myths? Well, the myths are that it's transmitted by various fluids that are not transmitted. You can eat together, you can work together, you can shake hands with a person with HIV and not get it. Those are the big myths with HIV virus. Okay? I want you to look at this pie graph. In 1985, men having sex with men was by far the number one cause of AIDS. A few years later, 22 years later, it dropped. It dropped. It's actually been about this same pie graph for the year 2019. That's the latest data that we have. Okay? This is men having sex with men, obviously heterosexual, IV drug users, and others. All right? So we dropped 15% in 22 years. And we haven't changed that much. The latest data we have is 2019. All right? So what's the natural course of HIV or AIDS? Stage 1, you get the virus. The virus will give you a flu-like illness. This occurs 1 to 6 weeks after infection. You have mild symptoms, and these are the mild symptoms that you have: sore throat, sores in your esophagus, muscle pains, lymphadenopathy, maybe a skin rash, maybe a little nausea and vomiting, some malaise, some headache, mild symptoms. Okay? But you are infected, and you can infect another person. Stage 2. Stage 2 is when you're asymptomatic. You might not even know you have HIV because all you had was the flu. This stage is free of all symptoms. You may have swollen glands, and the level of HIV in your blood drops to low levels. But we can detect HIV antibodies in your blood. This is actually how we diagnose the disease. We diagnose the disease with the antibodies to HIV. Stage 3, it now affects your immune system. Your immune system falls apart. And now you have all of these bizarre, opportunistic infections and cancers that start to appear. Stage 4. Stage 4, your immune system gets so weak that your CD4 cell numbers drop below 200, and now you've gone from HIV infection to AIDS. So now you have AIDS. Opportunistic infections occur if your CD4 count is below 500. And these are some of the things that you can see. And you can get bacterial infections, tuberculosis, herpes simplex, herpes zoster, vaginal candidiasis. All of these diseases occur in normal people. However, hairy cell leukoplakia and Kaposi sarcoma are very rare diseases and usually only occur in people that have AIDS. If your CD4 counts gets below 200, you have AIDS. And the opportunistic infections show up. And these are the big ones. These are the bacterial and fungal infections that are the big ones. TCP pneumonia, pneumocystis carinii, basically only occurs in people that have AIDS. Toxoplasmosis. Toxoplasmosis is a very rare parasite. It actually lives in cat feces and is very rare to attack humans. Cryptococcosis, coccidiomycosis, two fungi that occur in pigeons. It is very rare to occur in humans. Cryptosporidiosis, another bizarre parasite that is extremely rare to occur in humans. And you can get non-Hodgkin's lymphoma. This is the one lymphoma you can get without AIDS, okay? But all these other diseases is extremely rare to have without a destroyed immune system. Once your CD4 count gets below 50, which is basically the end, you're basically going to die, okay? And you get all of these bizarre diseases, which only occur in AIDS. Disseminated Mycobacterium avium, otherwise known as MAC, histoplasmosis, cytomegalic inclusion viral disease or retinitis, brain lymphoma, PML, progressive multifocal leukoencephalopathy, and then you get AIDS or HIV dementia. The most common opportunistic infection in HIV is tuberculosis. Tuberculosis is a widespread disease all over the world. It is a very uncommon disease today. But in the world, it's much more common. In Africa, in Europe, in Asia, it's a much more common disease. You really have to be immunosuppressed to get this tuberculosis, okay? It's Mycobacterium tuberculosum, all right? So TB and HIV are what we call double trouble. So how do we test for HIV? Well, it's basically anonymous. You can turn in your blood, or you can go to a clinic, an HIV clinic or an STD clinic, and get your blood drawn. No name is used. There's a unique identifying number, and results are issued only to the test recipient. There are many, you don't have to know the test. There's no reason for you to worry about this slide, okay? But there are many tests. But what we're testing for basically is the antibody. We're testing for the antibody. You can also do a urine blot test. And you can also do your own. I don't recommend this. I actually don't like it because if you swab your mouth and you send it off to get tested, the results only come back to you. No doctor knows you're taking this test. Imagine getting a report in the mail that says you have AIDS or you have HIV. Without a doctor talking to you, I would be worried that you would kill yourself. So I don't like this OraSure test, but it is available. It is available. What are the treatments? Well, there are many, many treatments. I want you to understand something. When it comes to treatment of diseases or treatments of disorders, I will never ask you a question on drugs unless the treatment is a hormone, which you should know, a vitamin, which you should know, or aspirin or non-steroidal anti-inflammatory agents. So don't worry about these drugs. I'm just giving this for your information, okay? The treatment of AIDS, the treatment of HIV is known as HAART, HAART, highly active antiretroviral treatment. It basically is three drugs together. And I'm never going to ask you these drugs. You don't have to know the specific drug, okay? The first drug that we ever used for HIV was AZT. And then you have others. And we'll talk a little bit about the others, but I'll never ask you the drugs. Do not worry about knowing those drugs. So what do you do if you have HIV? Well, you need to get your CD4 count every 3 to 6 months, because when it starts to drop, we need to treat you differently. We need to prevent your CD4 count from getting below 200. Because when your CD4 count gets below 200, you now have AIDS. And usually AIDS is a bad thing and you can't come out of it. Okay? You need to get a test for tuberculosis. This is a test for tuberculosis. It's a skin test. Many of you have had it. It's a skin test for tuberculosis. Okay? If you are positive for tuberculosis, you need to take this medicine. This medicine is called INH. It's called isoniazid. No, I'm never going to ask you this medicine. You need to make sure you don't have syphilis. These are the tests for syphilis. You need to make sure you don't have any of these bizarre diseases, toxoplasmosis, cytomegalic infusion, viral disease. You need to make sure that you are vaccinated against common diseases, pneumonia, the flu, hepatitis. You need to make sure you are also inoculated against Haemophilus influenza, a common cause of pneumonia. If you are a female, you need to get pap smears to make sure you don't have cervical cancer. Okay? As your CD4 count drops, here it's at 200. If it gets below 200, you need to be treated to prevent you from getting pneumocystis pneumonia. If your CD4 count drops below 75, you need to be treated to prevent you from getting Mycobacterium avium. If your CD4 count gets below 50, you need to be treated to prevent you from getting cytomegalic virus. So how do you prevent it? Abstinence. Easier said than done. Have a monogamous relationship with one person. Have protected sex. If you are a drug user, sterilize your needles. You need to make sure your blades, when you shave or cut, are new to prevent you from having blood on them from an HIV person. Obviously, abstinence is the most effective way of not acquiring HIV and AIDS. Refraining from unprotected sex, whether it be oral, anal, or vaginal, and refraining from intravenous drug use. This is easy. This is hard, and this is hard. So abstinence basically, in the long run, never works. A monogamous relationship. Make sure that the person you're having sex with has been tested for HIV, and also you, yourself. So if both of you are HIV negative, then you can rest assured that you can have sex without catching HIV. Protected sex. Always use condoms, and always use latex condoms. Latex condoms. Okay? And if you have oral sex, make sure you have a latex barrier. I'm not going to tell you how to use a condom. I think that you probably all know how to use a condom. All right? So some of these statistics, well, I just went, hang on. Statistics. These have not, I'm going to update these in another lecture, but it's a bad virus. It's a bad virus. All right? It kills a lot of people every single year. Every single year. PrEP. Pre-exposure prophylaxis. Again, I'm not going to ask you the names of these medicines. What I'm going to ask you, if I ask you anything, is what is PrEP? PrEP is a new prevention method for people who don't have HIV that want to have sex with someone who has HIV. Okay? Now, I can certainly tell you some personal stories of people that I know that were in love with HIV positive patients. And they would come into the emergency department or into the clinic and say, I'm madly in love with Joe, and he is HIV positive, and we want to have sex. How do I prevent myself from getting HIV? Well, we would say, use a condom. And of course, the woman would say, Joe doesn't want to do that. And we may want a child. I was like, and we go, okay, then we can give you Truvada to prevent you from getting HIV from an HIV positive patient. Okay? Only people who are HIV negative should use PrEP. And we recommend that every 3 months you should get an HIV test to make sure that this prophylactic medicine is working. Okay? Living with AIDS, you can live if you're HIV positive. Okay, look at Magic Johnson. Magic Johnson, I'm sure you all know who Magic Johnson is a basketball player who is HIV positive. He's had it for over 20 years. So you can certainly live with it. You can certainly live with it. All right? Know your HIV status. I think that's the last slide, and it is. Any questions on AIDS or HIV? I guess that would be a no, huh? All right. Let's now talk about allergies and allergic reactions. All right, everybody good with that? We see that okay?
Yeah.
Yes.
Good. Remember, I'm not even sure you're there, so talk up. All right. Oh, here we go. All right. Allergy reactions and anaphylaxis. What is the incidence of allergic reactions? Well, the incidence is pretty high. And in the United States, there are about 800 deaths per year from allergic reactions. The majority of allergic reactions are caused by giving someone a shot. And the number one shot that people get is an antibiotic. And the number one antibiotic is penicillin. Penicillin causes about 500 deaths per year because of allergies. Other than antibiotics, we also get Hymenoptera. Does anyone know what Hymenoptera is?
No idea.
Bees, wasp. Okay? They're wasps or bees. They sting. And when they sting, they can cause 100 deaths per year because people are allergic to bee stings or wasp stings. All right? So that is important to understand. What are the causes of death? Well, the causes of death is a severe allergic reaction. And when you get a severe allergic reaction, you get edema in your airway. You cannot breathe. You get wheezes in your lungs. You cannot breathe. 70% of all deaths are caused by breathing problems. Breathing problems. You also get cardiovascular problems. Circulatory collapse accounts for 25% of the deaths. So 70% is airway problems, 25% is circulatory problems, and less than 5% are strokes and heart attacks. But the major cause of death from an allergic reaction is lung disease, lung problems, breathing problems. Okay? So what is an allergic reaction? It is an over physiological response to a foreign protein. And you learned the other day that a foreign protein is called an antigen. It's an oversensitive response known as an allergic reaction. It occurs after your body is sensitized to the antigen. The antigen binds with the antibody. That is a severe allergic reaction. A less severe reaction would be an inflammatory response. Okay? You get a COVID vaccination, and the next day, your arm where you got the shot shows all the signs of inflammation. It's painful. It's red. There's heat there. and it's swollen. That is a normal inflammatory response. But what if I gave you the COVID-19 vaccination and within 10 minutes you couldn't breathe? That's the difference between an allergic reaction and an inflammatory response. Does everybody understand that?
Yes.
Good. All right. Allergic reactions are generally classified into three groups: mild, moderate, and severe. And we'll talk about each one of them. Mild. A mild allergic reaction, we're not talking about inflammation, we're talking now about an allergic reaction. You get urticaria. Urticaria is another word for hives. You get itchy. You get redness. That's called erythema. Your nose starts to run. That's called rhinitis. You get itchy eyes, conjunctivitis. You have a little trouble breathing, mild bronchoconstriction. You can't get the air out of your lungs because your bronchial tubes have been constricted. There's no shortness of breath. There's no change in your blood pressure. And all you really have to take are antihistamines. This is a histamine reaction. This is a histamine reaction. And now I'm going to ask a question that I need an answer from. Okay? What white cell has granules in it that produces histamine? And these granules and this white cell is very common with eosinophils in an allergic reaction.
Basophils?
Yes, you are correct. Basophils. Both eosinophils and basophils occur in an allergic reaction. Okay? Their count goes up. The basophil count goes up and the eosinophil count goes up. All right? So they both go up. But basophils, inside their granules, there's histamine. And the basis of an allergic reaction is histamine. So you need to take an antihistamine. Name me an antihistamine.
Benadryl?
Benadryl, exactly, Benadryl. Now, I told you I would never ask you that question because Benadryl is not a hormone. Benadryl is not a vitamin. And Benadryl is not aspirin or a non-steroidal. So you'll never, whenever you see the word Benadryl on a test, it's the wrong answer. I won't ask you that question. Everybody understand that?
Yes.
Good. All right.
Professor, I have a question.
Go.
So, like, the first time that you're exposed to whatever you're allergic to, isn't it typically like a mild, just to like kind of tell you that you're allergic? Like, is there typically an instance where you get exposed to whatever you're allergic to and then you go into like severe anaphylactic shock?
All right, let me explain that. That was a very good question, by the way. Who asked that question?
Mary Kate.
Mary Kay, an excellent question. Let me talk to you about antigen antibody reactions. For the most part, 90% of the time, you have to be exposed to a foreign protein to develop antibodies. If you're not exposed to it, you can't develop antibodies. But once you are exposed to it, you have to develop antibodies. And the antibodies are developed by T and B lymphocytes. The second time you're exposed, you can have a severe reaction. But usually the first time you're exposed, to a foreign protein that you've never been exposed to before, you only have a mild reaction. Okay? Does that make sense?
Yeah, that makes sense.
Okay, good. This is urticaria. This is the redness that you get, the hives. This is the hive, the rash that you get from a mild reaction. All right? I want you to remember this slide. Remember this slide, okay? A moderate allergic reaction. You have all the symptoms of a mild reaction, but now you are short of breath, difficulty breathing. This word dyspnea means difficulty breathing. And you'll probably have wheezes when I listen to your lungs, or you'll even know you've been wheezing. Okay? You can also have angioneurotic edema. This is basically swelling of your hands and of your legs. Okay? The reaction is now systemic. It's now systemic. It goes into your whole body. But you still have a normal blood pressure and you still have a normal capillary refill. Here it is, angioneurotic edema. Here it is, swelling. This lady may have had a shot of penicillin in her arm. But now look, her lips are swollen. So it's systemic. It's no longer localized to your arm. It's now in your entire bloodstream. A severe allergic reaction. A severe allergic reaction is called anaphylaxis. It is the worst thing that could ever happen to you in the allergic reaction realm. You not only have all of the other mild and moderate symptoms, but you also now have shock. Now your blood pressure is 40/0, and you're in respiratory distress. You cannot breathe. You cannot stand up because your blood pressure is 40/0. I need to ask this question. I told you to remember the slide on urticaria where you had red skin, you had hives. In an anaphylactic reaction, what do you think the color of your skin is?
White.
White. It is white because it's not being perfused. When your blood pressure is 40/0, your brain says, we don't need your skin. We need to keep your heart and brain alive. So only thing I'm going to give blood to is your heart and your brain. So your skin becomes white. Skin becomes white. All right? Anaphylaxis is the manifestation of immediate hypersensitivity in which the exposure of a sensitized individual to a specific antigen results in life-threatening respiratory distress followed by vascular collapse and shock. Anaphylaxis. A horrible, horrible situation. It's because the antigen has induced a severe antibody reaction. And the most common examples are the ones listed. Antibiotics, nuts, shellfish, wasp stings, animal serum, and incompatible blood types. These are the major causes of anaphylaxis. The antigen enters the body however it enters the body. You can eat it, you can absorb it through your skin, you can inhale it, or we can give you an injection of it. Okay? You eat a nut and you're allergic to it. You are allergic to poison ivy and you touch it on your skin. You inhale dust. You inhale smoke, or we give you a shot of something. Antibodies are produced. They attach to the surface of a basophil or a mast cell, and the mast cell becomes sensitized to that antigen. Mast cells are tissue cells. Think of them as basophils that are outside of the blood that have now gone into the tissue. They are in all tissues. All tissues. Basophils circulate in the blood. Mast cells and basophils produce histamine. The antigen now re-enters your body. It attaches to the antibodies on the mast cell or basophil. The mast cell degranulates. It releases histamine. It releases other chemicals called leukotrienes. It releases SRSA, slow reacting substance of anaphylaxis. It also releases eosinophil chemotactic factor. What is that? That means that these basophils need more help. So now they use a chemical factor to summon eosinophils. Basophils and eosinophils and mast cells are all involved in anaphylaxis and all allergic reactions. Your bloodstream vasodilates. When you vasodilate, you increase the surface area of your arteries and veins, giving you a decreased peripheral vascular resistance. You go into shock. One of the first signs of shock, which you will learn in the cardiovascular lecture, is a rapid heartbeat, tachycardia. Tachycardia comes first. Then your blood pressure drops. And then your peripheral skin is not being perfused because we must save important organs, namely your brain and your heart. There is increased permeability. You now have hives. You now have edema of the skin. You now have itching. You now have edema of your voice box, of your airway. You can't breathe. You are in respiratory distress. You make sounds that you can't breathe. It's called stridor. There is fluid leakage from your vascular space. You now go into what's called hypovolemic shock. So you get bronchospasm. You're in respiratory distress. Bronchospasm is called by bronchoconstriction. Will cause you to wheeze. All this smooth muscle spasm occurs in your GI tract, and you get nausea and vomiting, cramping, and diarrhea. You get bladder spasm. You lose your urine. You lose your urine. You've got to go to the bathroom, and you can't get there fast enough, so you wet yourself. It depends on how sensitive you are to the antigen. What is the root of the antigen in your body? Remember, we said there are 4 roots: dermal, absorption; ingestion, GI tract; inhalation, lungs; and parenteral, injection. Okay? What do you think is the quickest way to get an allergic reaction? Would it be to eat something, to touch something, to inhale something, or to get a shot of something?
A shot.
That's number 2, actually.
To eat.
Inhale.
Inhale. There you go. Inhale. You
So
get it into your, I'm sorry, go ahead.
I have a question. So I heard that like everybody is allergic to poison ivy, and like the different reactions are just like the severity of your allergen to poison ivy. Is that true, or is that just like a complete lie?
It's not a complete lie, it's a partial lie. 85% of individuals in the world are allergic to poison ivy. 15% of people are not, okay? But of those 85%, it is how allergic you are to it, okay? Let me, did Mary, is that Mary Kate again?
Yeah.
Okay, I can recognize your voice. Let me ask you this question. What if I was cleaning out my yard and I decided to get all the leaves and stuff and get all the weeds out, and I clean my yard and I have now a bunch of weeds and stuff, and I burn it. Okay? In that burn, there's poison ivy. What happens if that smoke gets into my lungs?
Well, don't you get poison ivy from the oils on the leaf?
Yes, you do. No doubt. It's usually by touching. But what if I burn it?
Would the oils burn off?
No, the oils do not burn off. What happens is if I inhale it, I now have poison ivy in my lungs. So that's a major problem in today. Okay? Does that make sense, Mary Kate?
Yeah, that makes sense.
Okay. All right. Severity ranges from mild to fatal. Okay? Most reactions are respiratory or dermatologic, touching poison ivy. Okay? Less severe early findings may progress through life-threatening over a short time. So if you are allergic to something, you can get worse very quickly. Initial signs and symptoms does not correlate with severity or duration of the response. Generally, however, the quicker the symptoms, the more severe reactions they are. So the first manifestations usually involve the skin, okay? And what you see first is redness. But the universal feature is itching. And this is the word for itching, pruritus. This is the word for itching. I got the itches. I'm allergic to something. That's universal. It also may be accompanied by flushing, more itching, and edema. It may progress to involvement of the respiratory system. Say you touch poison ivy and it gets onto your hands. You'll get redness and swelling and itching of your hands. If it progresses to get into your lungs, you now have a systemic reaction. You need to go to the hospital immediately. Okay? If it stays on your hands and after about an hour, everything is okay, you're okay. But if it goes from your hands and your skin to your lungs, you're in trouble. You need to get to the hospital. Obviously, if you have any of these symptoms from touching poison ivy, you need to get to the hospital. Just dial 911. Do not get into your car and drive to the hospital. I've seen that. It never ends well. Don't do that. Okay? So what do I see on someone who has an allergic reaction? Well, I usually see I usually see redness. I usually see edema. I usually see runny noses and runny eyes or itching red eyes. I see respiratory quickness. This is tachypnea, breathing at 30 to 40 times a minute. Tachycardia, heart rates of 100 to 200, and blood pressures of 80 over 20, 60 over 40. If you really are sick, you will have major trouble breathing. You will what's called laryngeal stridor. You will make sounds as you breathe. That's laryngeal stridor. I can't believe this is going to be on tape. Hypersalivation. You won't be able to swallow your secretions because your larynx is swollen. You'll have a hoarse voice and you'll have edema of your face. So, how do we care for people who have anaphylaxis or an allergic reaction? You have to know your ABCs. You must make sure your patient has an airway, is breathing okay, and has a normal blood pressure, circulation, airway, breathing, circulation. Get help. Get help. The drug of choice for anaphylaxis is epinephrine. I'll say it again. The drug of choice for anaphylaxis is epinephrine. Now, I'm going to ask you that. Why? Because epinephrine is a naturally occurring hormone that your body makes. And you'll learn much more about it in the endocrine system. We'll talk about the EpiPen. Make your patient comfortable. Remember, they're having trouble breathing. Give them oxygen. Calm and reassure the patient and get their butts to the hospital. Any questions on that? Does anybody use an EpiPen?
I have one, but I never had to use it.
Okay, I just want to make sure. Okay, it is a automatically injectable pen. All you have to do is touch the business end of the pen to your thigh, and it will give you a shot of epinephrine to prevent you from having a more severe anaphylactic reaction. It is recommended for people who have severe reactions to peanuts and wasp stings or bee stings.
I
Okay?
used to work at a garden center. I had to watch like my coworker get one in her leg.
Oh yeah, it can be deadly.
I have
Okay,
a sister
one-
who's. Oh,
Go
I have
ahead.
a question.
Yeah, go.
So I have a sister who's like allergic to like beef, pork, seafood, nuts, and all of that. And they told me, because I had to learn how to use an EpiPen, but they also said like it could affect her asthma if she ever had an allergic reaction. They would have to like watch her for like over a couple days. Is that true? Because I have another
Oh,
sister who's allergic too.
Oh yeah. She's allergic to a lot of stuff. That's interesting. Yeah, no, yeah. Her asthma would be 10 times worse if she ate all that stuff. Oh yeah, you have to be watched for a few days, no doubt about it. Anything else before we give our last lecture? Okay. This is the last lecture. Autoimmune diseases. Autoimmunity, the ability of the immune system to differentiate between self and non-self antigens. It's the immune system's response against self. You are now fighting your own body antigens. There are no more foreign proteins. Now you have what's called self antigens. Autoimmunity appears to be a normal part of the immune system. Healthy people have a low concentration of autoantibodies, antibodies to self, in your serum and in your tissues. Autoantibodies may form antigen antibody complexes, but these complexes are removed by macrophages as part of tissue damage removal. Autoantigens are known as self-antigens. Immunologic tolerance. There is no immune response to a specific antigen. We will give you those specific antigens. Here is what normally happens. I love this cascade. It is very well done. Your lymphocytes mature. And when they mature either in the bone marrow or in the thymus. And remember, there is antibody-mediated immunity and cell-mediated immunity. Stem cells in the bone marrow produce B cells. These B cells mature in the marrow. They are a part of antibody-mediated immunity. When the B cells mature in the marrow, they identify antigens. These B cells replicate to form plasma cells. These plasma cells either become memory cells, B memory cells, or they release antibodies. So this B cell can become a plasma cell, which will release antibodies to destroy the antigen. On the other side, you have cell-mediated immunity. The stem cells of the bone marrow go into the thymus and become T cells. These T cells are released into the blood and spleen and lymph, and the macrophages, the APC cells, antigen presenting cells, carry foreign cells to the T helper cells. These are known as CD4 cells. These CD4 cells then produce proteins against the foreign cells that are presented to them by the APC cells. They secrete cytokines. Cytokines can be interleukins. Cytokines can be lymphokinins. They now replicate into cytotoxic T cells. Cytotoxic T cells will destroy the antigen, or they will become T memory cells. Does that make any sense, guys? I need some feedback.
Yes.
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 Good, good. So we now talk about autoimmune diseases. What is an autoimmune disease? It's when the immune system attacks its own body cells. Attacking those own body cells produces an autoimmune disease. Here are some examples of autoimmune diseases. Some of you have heard of them. Some of you had no idea these were autoimmune diseases. Type 1 diabetes. your body attacks insulin-producing cells. The white cells and the lymphocytes attack your own cells. So type 1 diabetes, which is a total lack of insulin, is an autoimmune disease. Rheumatoid arthritis. Rheumatoid arthritis is when your cell attacks the connective tissues around your joints. Myasthenia gravis. Myasthenia gravis is a neuromuscular disease in which the body attacks the neuromuscular junction. Multiple sclerosis. Multiple sclerosis is an autoimmune disease which is the destruction of neurons in your brain and spinal cord attacked by your own lymphocytes and white cells. Those are autoimmune diseases. Okay? Most autoimmune diseases are treated with medications. But there are several ways in which the immune system will fail. When a pathogen is too violent, it replicates too fast. It causes too much damage. It invades the immune system. And that's really a major problem. And the solution to that is to be vaccinated against this pathogen or take medicines for it. You can also have immune deficiencies, which you inherit or acquire an immunological disease. Improper response to foreign non-pathogenic antigens. And this is what we talked about earlier. We talked about hypersensitivity, allergic reaction, and anaphylaxis. Or an improper response to self. And this is where the autoimmune diseases lie. An autoimmune disease is an improper response to self. Or a rejection of transplanted tissue, okay? And the failure to detect cancers are also autoimmune problems. Inherited disease usually can either be cellular or humoral. Cellular, obviously, is T cells because they kill things. So if there's a defective gene in the T cells, which make them not kill things, that's called inherited cellular immune deficiency. If there's an antibody problem, the antibody problem is called humoral. This is cell-mediated. This is antibody-mediated. When the B cell has a defective gene in it, and it will give you an immune deficiency. Or you can get them combined. Okay? You can also have acquired immune deficiency. Some of these diseases are basically genetic diseases, okay? But the treatment of these diseases are usually chemotherapy or radiation. Cancer is a big one. Non-Hodgkin's lymphoma, leukemias, those are acquired hemopoietic diseases, or infection, and we talked about AIDS, okay? Acquired immunodeficiency syndrome caused by HIV, which attacks CD4 cells, so that's an acquired immune deficiency. All right? Hypersensitivity, we talked about already. I'm not going to belabor the point, but we already talked about hypersensitivity and anaphylaxis. Okay? We talked about allergies. We talked about mast cells. We talked about basophils. We talked about their granules. We didn't talk about IgE. IgE, remember, begins with E. So eosinophils and IgE are all involved in allergic reactions. So when I ask you a question about IgE, the answer is allergic reactions. Very important. All right? Normally, the immune system does not attack self. This is ensured by the elimination of autoreactive lymphocytes. However, there is a large group of diseases in which the immune system does attack self. That is known as autoimmune diseases. Here it is. We talked about them before. Juvenile diabetes, in which self attacks insulin producing cells. Multiple sclerosis, in which self attacks the myelin coat of nerve axons. Myasthenia gravis, lymphocytes attack nerve muscle junctions. And thyroiditis is where lymphocytes attack thyroid tissue. They're very specific. In the systemic autoimmune diseases, you have SLE, systemic lupus erythematosus, rheumatoid arthritis, and rheumatic fever. Okay? What would cause the immune system to attack itself? Well, things change. Things are changing in self-antigens that make them look like non-self to the immune system. There could be a virus, there could be a bacterial infection that attack your cells to make them look like they're not your cells. You could have been attacked by radiation. You could have been attacked by a medication that decreases your immune system. Or you can smoke. Nicotine will cause the lymphocytes to not recognize some of your tissue. So that's important to understand. Transplant rejection. We didn't really talk about transplants, but you can't get a transplant from somebody unless you're a match donor. And to be a match donor, you must have their same blood type and their same tissue type. That's really all you have to know about this slide, the last sentence. The prevention of transplant rejection is finding a match donor, or you suppress their immune system. If you get a kidney from someone because you have kidney failure, you will be on immunosuppressive medication for the rest of your life, but you will no longer need dialysis. Okay? Also, an autoimmune disease is a failure to detect cancer in your body. The immune system doesn't recognize altered cell. It doesn't recognize the altered cell that is cancer and allows it to grow. So as you get older, your immune system becomes weaker. And the older you are, the more sensitive you are to cancer cells. All right? And I will now stop at this point because it tells me to. So let me stop recording.